This week we started talking a little bit about oxygen therapy. This is going to be information that you're going to need to know from this point moving forward. So I've got some low flow devices, high flow devices. We'll talk about the difference between the two. We'll also talk about the difference between FiO2 and FiO2, how to perform some of the air to oxygen entrainment ratio calculations, uh, the total flow calculations that come along with that, estimating FiO2, and so on and so on. So the first thing we'll look at are some of the items that we've got there. We've got a non-rebreathing mask, which is here. This non-rebreather mask is what's considered to be a partial rebreather. Notice that you've got a one-way valve here, a one-way valve here, and nothing over here. If this were a true non-rebreather, there would be another valve here. You've also got a reservoir bag. The reservoir bag gets attached, or not the reservoir bag, but the oxygen tubing gets attached to an oxygen flow meter, and you're going to run that between 10 and 15 liters per minute. I typically tend to tell everyone just to go ahead and turn the flow meter open as wide as it'll go, uh, because ultimately you want as much oxygen going into this reservoir bag as you can. If the patient's wearing the reservoir bag and they're causing this bag to collapse as they breathe in, you need to increase the input flow through the oxygen tubing. So ultimately, when the patient breathes in, this valve here will open, and that will allow as close to 100% or 100% oxygen that's in the bag, the reservoir bag, to be breathed into the patient's mouth and nose. And then when the patient exhales, this valve closes so that there's not any exhaled CO2 or exhaled gas going into this bag. It's fresh 100% oxygen. And then when the patient exhales, this one-way valve opens and they'll breathe in. Now you can get close to 100% with a non-rebreather, but it's probably not going to be quite 100% because as the patient's breathing in, they will also breathe in room air through those dots. However, the majority of what they should be breathing in should come from that reservoir bag, which is 100%. So just to kind of talk about flow meters right quickly, let me find a lab station that has them. So got them over here. Let me get this wheelchair out of the way. And this is a medical airflow meter. You've got oxygen flow meter. We're learning about safety systems as well. So you've got the diameter index safety system that's utilized with your wall station outlets. So you've got medical vacuum. You can notice that medical vacuum and medical air are similar in size, but they're not the same. So only a vacuum regulator is going to go to that vacuum inlet, as opposed to only an air regulator is going to go to that air outlet, and an oxygen regulator is only going to go to that air outlet. There are little check valves inside of the outlet, so if you were to depress that, and if our lines are charged, you'll hear the oxygen gas leak from the wall. Our working pressure is 50 psi. So the working pressure for respiratory therapy equipment is 50 psi. It's a little bit easier for me to get to the airflow meter, so I'll utilize this one. And I'm going to take this barbed adapter or the Christmas tree adapter off. This will make it easier for you attaching your oxygen tubing to those items. It is important for you to be able to practice taking these on and off the wall. So left to loosen, right to tighten. And you may need to put a little bit of inward pressure on that as you're placing it into the wall. But one thing I want to show you is when you're reading a flow meter, whether it's an oxygen or an air flow meter, you're going to want to you're going to need to turn the needle valve open, and now you can hear flow coming out. But we're going to want to make sure that if we were going to set this to say 3 liters per minute, you want to make sure that that ball is bisected by the line that runs by 3 liters. So I would need to look at that head on and make sure that that ball is bisected by that line at 3 liters. If the ball is above the line for 3 liters, you're given more than 3 liters per minute of flow. If the ball is less than that, then you're given less than 3 liters per minute of flow. This flow meter is calibrated to provide a liter flow of up to 15 liters per minute. So I'm going to turn it up to 15 and let you hear that. Now, if this is up to 15 liters per minute, is that flow meter capable of delivering more flow than 15 liters per minute? It's only calibrated for you to measure that, but yes, it certainly can deliver more flow than 15 liters per minute. So if I were to turn this go, and that's what you hear coming from the flow meter. So that's important as I utilize a bag valve master in a code blue situation, or if I'm utilizing a non-rebreather, or if I'm trying to satisfy the total amount of flow going to an individual, I will keep that in mind, that an oxygen or air flow meter can provide more liter flow than just what's calibrated. Same thing with our oxygen flow meter. You know, you would still read that the same and utilize that. Definitely make sure that you are attaching, when you're wanting to provide supplemental oxygen to an individual, make sure that you are utilizing the oxygen flow meter. And again, this is a diameter index safety system. It works with less than 200 psi, but it is coming from a line system hooked up to a pressure reducing valve that takes the high pressure and reduces it down to our working pressure of 50 psi. So that's going to be important to remember moving forward. So the amount of oxygen that comes out of the wall, if you're utilizing an oxygen flow meter, is going to be 100%. And you can gauge that at 1 liter, 2 liter, 3 liter, 4 liter, and so on, up to the calibrated value of 15 liters. If you're utilizing a medical grade air flow meter, the amount of oxygen that comes out of the wall is 21%, because that's the same air that you and I are breathing. It's 0.21 would be the FiO2 associated with room air. So you cannot provide any higher than 21% if you are utilizing an air flow meter. You can utilize more than 21% if you're utilizing an oxygen flow meter, because it is 100% oxygen that's coming from the wall. So that's going to be important for us to remember. Those are Thorpe Tube flow meters. Your Thorpe Tube flow meters can also be pressure compensated or pressure uncompensated. One way you can tell the difference in that is the position of the needle valve. So ultimately what occurs is, let's assume that I'm providing supplemental flow to this patient at 4 liters per minute. So if the oxygen tubing that's attached to that were to get kinked and it's not pressure compensated, it would continue to read four liters per minute, and I may not be able to realize that maybe the hospital bed or what have you is sitting on that oxygen tubing and no longer allowing flow to go to the patient. And I know that I'm looking at a medical air flow meter. It's easier for me to get to that right now, but this is all applicable for an oxygen flow meter. If it's a pressure compensated one, if there happens to be a downstream occlusion, then you will see that ball drops. Ball drops so that you know there's no flow going through the system. So that's one way that you can tell if your flow meters are pressure compensated or not pressure compensated.